This is component 3 mock, and this is mock number 4. We're on to question 5. Kidneys can become damaged by injury or disease. Give 4 possible effects of kidney failure, and there's 4 marks, so straightforward where the marks are coming from. There is a video on various kidney failures, but you could do this from your theory. What's the kidney for? It's for removing urea. So if the kidney fails, presumably the urea won't be removed from your blood. So that's the first obvious answer there. So increased levels of urea in the blood. So remember, urea is a toxic byproduct of your metabolic processes, so you need to get rid of it, and the kidney, that's what the kidney's for. And then also think of what the kidney does, regulating ions and salts and uptakes and things like that. So think about that not happening, and then you can possibly suggest an increased level of those. So increased levels of ions, or you could give an example there. And then lots of other possibilities. Let's just try and pick out the more obvious ones. Possibly, what's the kidney produces urine, so if the kidney's not working, you're producing less urine. So there's a reasonable suggestion. So reduced volume of urine. And now along those lines, you know about the regulation of the water potential using the kidney. So if the kidney's not working, the water potential won't get regulated in the same way. So for example, an increase in water potential of the blood, and various other suggestions on the mark scheme. I'm not going to go into those, but those are 4 that you would be thinking about from your knowledge of what you know about the kidney. Part 2. Suggest why heart disease or the loss of a large volume of blood, there's a big clue, can lead to kidney failure. So either losing some blood or heart disease where the blood isn't being pumped properly could lead to kidney failure. Well, either of these two would lead to a fall in the blood pressure. Either it's not being pumped hard enough because your heart is diseased, or there's just not enough in all of the tubes, all of the blood vessels, to maintain the pressure. So fall in blood pressure. And you know the first process that goes on in the kidney, ultrafiltration, relies on the blood being at high pressure going into the glomerulus. So that process won't take place as effectively. So ultrafiltration will not take place, or words to that effect. Then we are into an excellent photo of a fistula, where at first you think this is a problem, but they seem to have done this deliberately. They connect an artery directly to a vein. Sounds like an excellent experiment. Perhaps we should do that in class, and explain the appearance of the vein. Okay. So the arteries are, are at high pressure, and the veins have a thin wall, a larger volume. So if you direct all of that high pressure into the vein, it'll come up like a balloon, which is exactly sort of what you see on those balloons that they make shapes out of. So we just need to put that into words. The cause of this is the high blood pressure in the arteries. So high blood pressure from the artery, and then the vein can't really cope with this blood pressure, and it doesn't have the elastic and muscle, so that's why it balloons up. So the vein does not have a thick muscular wall, and so it expands in the photograph. There's your 2 marks there. And then there's quite a lot of information to do with dialysis. I'm not going to go through all of it. Handily they've put a ruler on to show you the size, something that everybody recognises. And then the questions really are, a lot of them are kind of common sense. Why the dialysis fluid? So this is the fluid that's going to be in contact with the blood and then moving away, have to be constantly replaced. Well, this is like any gradient or ventilation or anything like that. The answer is going to be the same, and that's to maintain a gradient for the substances to move across. So this maintains our concentration gradient or our diffusion gradient. So maintains the concentration gradient for diffusion. Otherwise we'd get to equilibrium, and the stuff we want to move, urea, there won't be a gradient for it, or it might even start there. It's only there moving back. Part 2, explain why the dialysis fluid moves in the opposite direction. This should ring a bell from your fishy memories. And it's exactly the same as the countercurrent flow in the fish, and then the explanation is just the same. So counter current flow, and that maintains the concentration gradient along the length of our tube. So countercurrent flow maintains the gradient, better put concentration there, along the length of the tube. Part 3. Explain why during some dialysis treatments calcium ions diffuse from the patient's blood into the fluid, but during others they diffuse from the fluid into the blood. You're not supposed to be an expert in calcium ions. You shouldn't really know anything more about calcium ions, but you're supposed to use your knowledge of mechanisms of transport and diffusion just to suggest why they might move. And it's just simply because there may be a higher concentration in one place than another. So depending on the concentration in the blood, it might move one way or another. So for example, high concentration of calcium ions in the blood. So diffuses from the blood to the dialysis fluid, and low concentration of calcium the other way around. So just the calcium ions might vary in concentration from one person to another. Part D. Transplanted kidneys are more efficient than dialysis, but there are some issues concerning this technique, and 2 reasons against the use of kidney transplants. Well, there's maybe some practical reasons and maybe some ethical reasons. Practical reason is it depends where the kidneys come from. If you have a very good friend who offers to give you a kidney because they don't need to currently,
don't even ask.
Don't even ask. They'd have to be a slightly better friend than Miss Nicest to me. Then there's problems with surgery, and the problem with leaving the other person with just one left. So a risk to the living person who has donated the kidney. For example, surgery, or the risk only having one. And then things like risks of infection or an immune response from sticking the kidney in. We don't know a lot about immunity unless you've done had a go at that part of the option, but you know there might be an immune response, leading to things like rejection of the kidney. You might have heard of that. And then into the ethics. Well, some people will object on religious grounds to the transplants of organs. So ethics of transplants. Some people might think it's wrong to take an organ from a dead person, or a person that's nearly dead, brain dead. So from dead people, someone might object to that. So there's there are some more as well, but we're not going to go into those. It's only 2 marks, and the kind of the obvious ones are there. And part E, the kidney also acts as an endocrine organ. What is meant by endocrine? Now you'll have met this and its twin, exocrine, and these secrete things, but it's really where do they secrete them? And so endocrine secretes into the blood, and exocrine secretes elsewhere, like for example pancreas secreting into the gut, that sort of thing. So it secretes, for example, hormones into the blood. A little extra mark there just to make something add up.